skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Napoleon Hill says, "The body achieves what the mind believes in." Good evening. Welcome to another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. The origin of this virus comes from Italy in the 15th century, from the epidemic that was associated with influence of the stars, and thus the word influenza, or commonly called flu. To dive more into this discussion, we have with us Dr. Divya Sharma KR, specialist in internal medicine at Al Hilal Hospital Hit with over 5 years of experience. Welcome to the show, doctor.
Thank you so much for inviting me for this show.
Let's just jump into the discussion straight away. What is seasonal influenza?
Seasonal influenza means it's kind of virus. It is an acute illness of respiratory tract caused by the influenza virus. What do you mean by seasonal? Why it is called as seasonal? Seasonal means it happens every year during the time of winter, because these viruses usually survive during the time of cold weather. So that's why it is called as seasonal influenza.
And what are the symptoms of seasonal influenza?
Seasonal influenza presents with multiple symptoms, which are mainly limited to the nose and the throat. Mainly severe runny nose, myalgia, body pain, joint pain, tiredness, fatigue, severe headache, dry cough and fever. So these are the most common symptoms of seasonal influenza.
Ma'am, these symptoms that you stated now are also associated with common cold as well.
Yeah.
So how do you differ common cold from influenza?
Yes, that's a good question. Actually, common cold is a simple viral infection of the nose, and influenza or the flu is a involvement of the respiratory tract caused by the influenza virus as such. So how they differ? Mainly common cold present with minor symptoms. Most of the time it is because involvement of the nose, rhinitis, runny nose, or it is mainly associated with the mild low grade of fever and headache, and sometimes it is a congestion. But in case of influenza, the symptoms compared to the common cold are much stronger. Very high grade fever, like it presents with more than 38 degree of temperature, severe tiredness, joint pain, weakness, headache and dry cough, also sometimes throat congestion. So most of the time this common cold and the influenza can be differentiated between the symptom severity. Common cold having a minor symptoms, this influenza will have little stronger symptoms, but both are self-limiting illnesses. They will take their own course for around 5 to 7 days.
Okay. What type of viruses causes influenza and how does it spread?
Influenza, as the name suggests, it's an influenza virus which comes under the family called as Orthomyxoviridae. Okay. So that is a viral family. So it has a different subgroups like A, B, C, D. So we categorize them into different groups. Basically for a humans, A and B subtypes are very important. Those subtypes causes illness in the human as an influenza or a flu. So these influenza viruses, they survive in the cold environment, that is in case of winter. So they survive in the winter because this environment helps in multiplication of these viruses.
Okay. If a person is infected with influenza, how quickly does it spread with others?
Yeah, that is called as incubation period. There is one term, incubation period. That means that it's a time required for the virus to multiply in the body. Once this virus enter into your body, so this has to multiply to develop the symptoms. So, in case of influenza virus, it takes around 3 to 4 days to multiply and to develop symptoms. So, whenever person is exposed to the influenza virus in the environment, initial 3 days or 4 days he will be completely asymptomatic, then he starts to develop symptoms. That is called as incubation period. Okay. So, this incubation period is not constant one. It can be like, it can vary from individual to individual depending upon the immunity levels and number of exposures and other various factors are there with them.
Ma'am, you just spoke about it can depend on various people according to their individuality. Okay. So, if that's the case, if they have respiratory symptoms, how do they know that they have flu?
So, basically this flu, as I was explaining before, flu is an acute illness, like it starts immediately. So, one person is completely asymptomatic, he will be going for his work or somewhere outside. At the end of the day or after 2-3 hours or after 2 days or 3 days, he starts noticing immediately like high grade fever or runny nose, as I was explaining the symptoms of influenza. So, in case if they develop these symptoms in a pre-existing respiratory illness with the high grade of fever, that is a typical symptoms of influenza in a season, like in case of winter, then we can consider that this person is going to have or is already having the flu.
Are there any carriers of influenza?
No. As such, influenza is a virus, so only carrying the virus and spreading the infection is very rare. So, there are no carriers for influenza virus. There will be a direct spread either, or the person who is having the symptoms, who is carrying the virus, can spread the infection.
Okay. So, who is at the greatest risk of getting this infection?
Yeah, normally what happens is like in a middle-aged person, individual with the good immunity, chances of getting infection, even if you are infected with the virus, the symptoms are very less. Symptoms, they will get minor symptoms, either low grade fever, tiredness, which will last only for 2 to 3 days and it will get settled off by its own. In case of high risk individuals, like as we were asking before, pregnant women or elderly individual or chronic diseases like diabetes, which is not controlled properly, or heart conditions or asthma or chronic bronchitis, or very young individuals like less than 5 years of age, children, they are very prone for developing the influenza, also developing complications secondary to this influenza infection. Why? Because these individuals usually they have their immunity to the little lower side, hence these viruses can easily get into the body and start developing symptoms. So, these individuals which I was explaining, like high risk individual, should be very careful in case of seasons, like especially in the winter season where influenza will be roaming around in the environment.
How can one protect himself and his family from influenza?
Yeah, so what happens is when if the patient already got the infection, so he should be very careful to take care of himself and also to protect from transferring the infection to the others. That is very important thing. But before getting the infection, how you can protect yourself is like mainly, as I was explaining, influenza spreads by 2 modes, either by a direct transmission to the droplets. So, there are droplets. Droplets are nothing but a small particle which are coming out while coughing or sneezing. These are mucus particles coming from the nose or the mouth while sneezing or coughing from the infected individual. So, when they cough, what happens is like these droplets usually spread to the environment. So, if another person standing in front of the patient and receives these droplets, they directly enter into the nose and the oral cavity, they causes infection in that individual. So, it's always important to take care of yourself if you are having influenza by proper closing your nose and the mouth while coughing and sneezing, either by using disposable tissues so that you can throw it off. So it will not, it will protect yourself to prevent, to the spread of the infection to the other individual, or proper usage of surgical mask. So whenever you go outside, or if you are staying at your home, if you are infected, it's advisable to use a proper surgical mask so that it will protect the spread of the infection through the droplets. There is another way also to for the development of infection, that is by the direct contact, like individual who are having this influenza virus, they can spread the infection through the direct contact also. For example, if one person is having an influenza, if he coughs or sneezes, while coughing or sneezing, if he keeps a hand in front of the mouth or the nose, these respiratory droplets will come to your hand. So if you are not washing your hand, or if you are not cleaning it, so what happens, the virus will be there in the hand, and it will, if you meet your friend or someone, so if you give a handshake, what happens, this virus will easily spread to them. So from there, if they use that hand to rub their nose or the mouth, so what happens, this virus will enter into their body. So this is very important to protect spreading the infection by these two measures. That means using a proper mask, and second one is hand washing. Hand washing is very important so that we will be removing infected organism from our hand. Proper hand washing is very important. And third one is vaccination. So it's very important to vaccinate yourself so that your immunity will improve and the chance of getting infection is also less, and in case if you get also, duration and severity will come down.
Ma'am, you spoke about vaccination. Which risk population should get vaccinated and who should not get vaccinated?
Yeah. So vaccination is a preventive strategy actually, because whenever you are taking a vaccine, this will help in improving your immunity against the virus. So in this case, in influenza virus, basically we will be giving influenza attenuated or killed vaccines to increase the immunity and also to reduce the chances of getting an infection, and also in case because we cannot 100% say that you can protect the infection by taking a vaccine. Vaccine is efficient around 40 to 60% of individual. That means out of 100 individual, 40 to 60% individual may not get infection. In 40% of individual, even if you get, the chances of developing or chances of getting a severe infection will come down. Mainly it reduces the severity of infection in case if you get even after vaccination, or also it reduces the duration of the infection. So that is, in that way, this vaccine is very helpful to reduce these two conditions in case of influenza virus. And also you were asking like who is supposed to take the vaccine. Like it's like everybody can take the vaccine during the or just before the time of winter. Because as I was telling you before, this virus is easily spreads during the cold seasons, especially in the winter all over the world. So what happens, if you protect yourself before the winter by taking influenza vaccine, your body will develop a lot of antibodies against the viruses. So in case if you get infection also, it will be very mild, and chances of getting infection also very low. So always this influenza vaccine is very important to take every yearly. And also as I was explaining, high risk individuals like pregnant women, elderly individual, very young children, and also the chronic disease patients like chronic diabetes with poorly controlled sugars, or heart condition, or asthma, or chronic bronchitis, their immunity is compared to the normal individual is little lesser side. So chances of getting infection and getting severe infection also very high. So they must take this influenza vaccine yearly to reduce the infection rate. So almost all the patient can take. As you were asking, the contraindication for the vaccine is very less, unless in case if they have allergic reaction to the component of the vaccine, then it is not advisable to take the vaccine. And also one more contraindication, like they say that very young individual, very young kids, like around less than 6 months of babies and all, it's not advisable to take vaccines. These are the only two contraindications, or we can say just like, you can avoid it in case of, they can develop allergies and all.
Ma'am, you spoke about hand washing and its importance. Like how important it is in avoiding influenza, and also few people have suggested to use alcohol gel for hand washing. Is that safe to use it?
Yeah, definitely, because hand washing technique is very important. Why it is important? Because as I was explaining before, these particles, the virus particle, when you cough or sneeze, definitely it will come out of the mouth and the nose as a droplets actually. It will be there in the hand. So when you use hand washing recurrently, this will come out of the hands and it will go away. So, regarding usage of alcohol based formulation for hand washing, this is very good. So, you can use. So, multiple time hand washing is very important. In every time when you use the hand washing solution, you are going to remove the bacteria or viruses in your hand. So, it will help in reduction of transmission of the symptoms.
Ma'am, you spoke about the droplets being transmitted. So that can be avoided by wearing masks.
Yeah.
But the question is, what type of masks must be wear, as we have so many masks in the market right now?
So it can be a simple surgical mask is enough, because in what happens is these droplets are bigger one. So these bigger droplets, which when they come out, so if the person is standing in front of the patient, within 1 meter distance he can get it. So droplets are usually bigger, so you can use a normal surgical mask which is available in the nearby pharmacies. Another one is that if you are not comfortable wearing mask, so you should use a disposable tissues actually, so that every time you can change the tissue so that the spread of the infection will be less.
Is it necessary to get vaccinated every year, and what are the benefits of flu vaccine?
Yeah, so since I was explaining, as the name suggests, seasonal flu. Season means every yearly this flu will come in the winter time. So it is necessary to take every year before the time of winter, as I was explaining before. So why we have to take every year? Because as we know, once we get a virus, definitely there will be development of antibodies, and this will protect us from getting another infection. But why we have to take every yearly? That is important because these viruses, most of the viruses, especially this flu virus or influenza virus, they have one capacity of changing their outer protein. So what happens, every year they modulate or modify their protein so that they will easily get into the human body and multiply. So what happens when they change the antigen over the top of their body? So what happens, it will be considered as another virus or another kind of virus in the body. So our immune system consider it as a different virus. So definitely the symptoms and the signs of the flu you will develop. That is why it is important to take every year vaccine, so that depending upon the type of virus which is moving around in the environment, the vaccine type also will vary. So every year it is important to take a vaccine so that you can protect yourself by different kinds of influenza viruses.
Okay. And the benefits of the vaccine would be?
Yeah, as benefits are a lot actually. So mainly if there are two individuals, one with the vaccine, one without vaccine, how it will help? The vaccines usually what it does, it will improve your immunity in the body, antibodies will be developed, so that I was explaining before, it will reduces the chances of developing complications. Complication means, as I was telling before, around 90 to 95% of flus are actually, it's like a simple common cold, like they present with the minor symptoms of fever, tiredness, sweating, which will last only 5 to 7 days. But in case of high risk individual, they can go for complications. Complications, what are the complications of this flu or influenza? Is like along with the common symptoms of fever, tiredness, joint pain, fatigue, headache, in case if the symptoms develops and present for more than 5 to 7 days, like persistence of the symptoms associated with development of new symptoms like shortness of breath, breathing difficulty, or if they develop persistence of cough with the mucus production, heavy mucus production, or persistent of headache, or consciousness level, alteration in the conscious level. All these are the complications of flu, which is very rare, but chances are there in case of high risk patients. So, these vaccines, what they do is protect these individual from developing these all complications. So, it is always good to take this vaccine to protect these. And also, in case, as I was telling before, in case even if you take a vaccine and even if you get an infection, this will reduce drastically the symptoms. They can just get some kind of runny nose, minor fever and dry cough, which will last very short period like 2 to 3 days, and it will settle down. So, does not require much treatment also, they will be better within few days. That is how this vaccine helps to improve our quality of life and reduces the hospital visits.
Okay. So, what are the possible side effects of this vaccine?
Usually this is one of the safest vaccines, like most of the time we do not see much of side effects with this influenza vaccine. Very rarely, in case sometimes you may get local reaction where we give a injection, local redness, pain, tenderness will be there. It will fade away within 12 to 24 hours, or maximum up to 2 days it will be there, then it slowly will come down. Rarely it can cause minor flu symptoms like runny nose, some kind of muscle pains or fevers, which will be very short period, and it will fade away within 2 to 3 days. No need to have much doubtful about this condition actually.
Ma'am, there is a misconception that flu vaccine may cause flu infection. Is this true?
No, it is not true actually, because flu vaccine is like we will be giving kill vaccines. So, it is basically to improve your antibodies. It may cause flu like symptoms because our immunity will be trying to improve the levels. So, that time you can get a flu symptoms, but it will not cause you flu or influenza itself.
When must a person get vaccinated?
Like as I was telling, usually this vaccine ideally you should take just before the winter season or just before the cold weather it comes, but it is ideal one. But any time, even in the winter time, even if you forget or if you don't take, if you have not taken vaccine, any time you can take throughout the year. In case if you are getting recurrently upper respiratory infection later in the winter time, if you feel like taking, you can take to protect subsequent infections, because as I was telling you, one person can get this influenza virus multiple times. So, any time of the if you have forgotten to take or if you are not taken, you can take. Ideally it is good to take before the winter, but after time also you can take. No issues with taking with the influenza vaccine, but try to avoid, in case if you are having a flu symptoms, typical high grade fever and muscle pain, tiredness, try to avoid during the period of infection, which is not good to take. Once infection settle down, later you can take the vaccine. That is ideal one. So, it is important. Yeah, that
was the answer for my next question. Can a flu infected person take the vaccine?
Yeah, that is what. So, as such, in the flu time where you have high grade fever and typical symptoms of flu, it is like it's better to avoid it, because again giving one more vaccine with causing symptoms, it is not good to take it. Try to recover from the flu and settle down. Once every symptoms comes down, later you can take the flu vaccine. That is very important to take care of it actually.
Ma'am, can pregnant women take the flu vaccine?
Definitely. As I was telling before, pregnant women are they comes in high risk group. So, what happens is it is very important to protect them from influenza infection. So, they can take vaccines, skilled vaccines, so that they will develop a immunity against the virus, so that the severity of an infection will come down. So, chances of getting into complications will be very less if you are taking.
What is the treatment for flu and how is it diagnosed?
Coming to the treatment of flu, most of the time it is a symptomatic treatment, as I was telling you. They are the minor symptoms. Patient themselves, they can take for high grade fever, paracetamol every 6th hourly you can take, and also like for allergies like runny nose, sneezing and all, you can take antihistaminic and take rest at home. So these are the common things. In case of high risk individual, it is advisable to go to the nearby hospital, because as I told, no, the chances of developing complications will be little more. So it's always better to go to the nearby hospital, consult your doctor, and after examination, in case if anything is required, doctor will advise you accordingly. You can take the medication. But regarding the diagnosis, you were asking, diagnosis mainly it's a simple procedure like how we used to do for COVID-19. Like we will be taking a nasal swab to check for any antigen in the viral, any particles are there, then within 15 to 20 minutes we will get the result. This is called as rapid influenza test. So we will be checking for influenza A and B. So in case if it is showing any positivity, accordingly we will treat it. Positive means there is a influenza virus. So if it is positive, then in the hospital setup we will treat with the antivirals. Antivirals means these are the medications given to kill the viruses actually. So most of the time these antivirals will be effective within first 2 to 3 days of the symptoms, 24 to 48 hours of the symptoms. If you start taking that, then the severity and the duration of the symptoms will grossly come down. So after 3-4 days, taking antivirals may not be that much effective. Initial days, if you have a severe symptoms and if you consult to the doctor or hospital, if you go, in case if they found there is a like typical of influenza symptoms, then doctor may start for these antivirals. Then this will grossly reduces your symptoms and also duration. That is very important. Otherwise, in case if you develop symptoms more than 5 to 7 days, then usually we don't advise, because it will come down by its own. Only the symptomatic treatment by drinking lot of fluids to keep yourself well hydrated, take rest and protect others by preventing the spread of the infections.
Ma'am, you just mentioned before that there is a change in the protein structure in flu. That was also a characteristics of COVID-19 as well. So what is the difference between COVID-19 virus and this influenza virus?
Yes. So recently we had COVID era also. So basically what happens is like COVID virus and this influenza, all are viruses only. They have, most of the viruses, they have a capacity, as I was explaining, to change their protein. Symptomatically also, this flu or the influenza and the COVID, they tend to present with the almost similar symptoms. Only difference is this COVID is little stronger and it can present the symptoms for a longer time and little in the severe form. Like in case of influenza, high grade fever and respiratory symptoms, which may last only for 4 to 5 days, maximum 7 days it will be there if you are having a good immunity. So, but in case of COVID virus, what happens is the symptoms, in case of your getting first time, the symptoms may take a little longer time and it can be severe also. Like you can develop a complication little faster, and complication chances are more compared to the flu. Basically, you may develop respiratory depression or breathing difficulties, headache and systemic symptoms like vomiting, loose stool. It can present in various symptoms, tiredness, fatigue, involvement of internal organs, failures, all those things are common. Means complications are more commonly seen with the COVID virus compared to the influenza virus, because influenza virus is every yearly we can see. COVID is a new virus which is recently detected. So, since it was a new virus, we never had this kind of antibodies in our body. So we most of the individual had a lot of complications because of this virus. So that's how it is little severe and more stronger compared to the influenza virus.
All right. Thank you for your valuable time, ma'am. It was a pleasure talking with you, and you gave a detailed discussion on what is influenza virus and its symptoms and its preventive measures and everything. Thank you for that, ma'am.
Thank you so much for calling me here.
I hope you all had a detailed session on influenza virus and its preventive measures. For more such informative sessions, please tune in to Al Hilal Health World every Tuesdays at 8 p.m. only on BMC Global Life. I'm Abhijit Joseph signing off. Good night.